Hi, good afternoon, everybody, and welcome to today's Health Promotion Live State of Wellness webinar. Today we have the state of Michigan. We'll get started in a second. A few housekeeping things. If you're taking this class for credit, and we do offer CHES, ACSM, and RD credits, you'll be sent a follow-up email. It'll have a link to the website where you can purchase the credits, and if you look over in the chat box, there's also a discount code down there. Enter that discount code at checkout and you'll get 25% off your credits. So today we have Teresa Lovely, as always, introducing our presenters. So take it away, Teresa.
Hello, everyone. We're glad you're here today to hear Christy present on Michigan's healthy businesses. And we're happy you're here, Christy. And I want to take this moment to introduce you. Christy Demitz from Michigan Department of Community Health. She's a public health consultant. Christy has 10 years experience in disease prevention and management in public health, with the majority of this time focusing on cardiovascular health. Christy has a meaningful worksite wellness testimony, and she says that worksite wellness changed my life, and referring to being a participant in a wellness program at a previous employer. Then later, Christy coordinated a walking program for the executive, judicial, and legislative branches called Michigan Legislative Health Challenge. It was a very competitive program, and those of us in Worksite Wellness know what that's like on those really competitive ones. And now she is working on an online worksite assessment and a worksite wellness guide, and based off, and her guide is based off, and she says, the now famous Wisconsin guide, and I know what she means there. Kentucky's is also based on Wisconsin's. And Christy started with a worksite wellness program in her own building by accident. And so, Christy, maybe you'll tell us about that, what that means, 5 years ago, and that program is still going. So something tells me you're a natural, Christy, when it comes to worksite wellness. Christy has a master's in social work.
I have just been in the wrong place at the wrong time, or the right place at the right time.
So this was something Christy shared with us, started by accident, so I find that very interesting. Christy has a master's in social work, and another point for Christy is sharing with us, she has a high regard for people who work day in and day out making the business case for worksite wellness. So Christy, I'll hand it over to you. And thank you for being here.
Oh, thank you for asking me. It's a great honor, and good afternoon or good morning in the case, as the case may be for some of us here. I want to thank Michaela and Teresa and Kelly for asking me to present, and then all of you for registering for the webinar. And I've tried to attend as many of these State of Wellness webinars as I could over the past year, starting with Teresa's over a year ago. And I am just so impressed with what's going on out there in the world of worksite wellness. So when I was asked to present, I'm thinking, oh my gosh, what can I possibly add to what has already been presented? And what we decided to do was tell Michigan's story. And we started with worksite wellness back in the 80s and have continued in some way, shape, or form until the present day. So what I'm going to do today is to present decades in the making, all of our little stories and pilot projects and experiences, different projects that we have done over the past 3 decades, some of the lessons learned, so you don't have to, or maybe you've learned the same lessons, and then some of the sustainable pieces that we've had from each of the projects. And then I'll highlight, I can show you some websites and some snapshots of some of the websites, and have included the website addresses, so they will be very handily accessible to those of you that print out presentations and keep them for future reference. I do have a few modifications to the slides that were posted on the website, I believe, so we will make those available after the presentation. But as I was thinking about decades in the making, I also thought that that has another connotation, that those lifestyle behaviors that employees or me, I engaged in decades previous, have health implications for employees right now in our workplaces. So this presentation is meant to be fun, have a little bit of information, and share with you some of the ideas that we've used. So maybe that you can, if you haven't started a worksite wellness program, maybe this will give you some direction, and if you already have something going, that you could use some of these resources to complement what you have going. Okay, so we have seen quite a change in some of the healthy or unhealthy behaviors that we engage in over the past 30 years. In the 1980s, and while we're talking about work sites and businesses and things like that, I'm just going to give you a couple factoids about the different decades. The average income in the 1980s was $19,500. The success of Reebok was generated through the aerobics fitness craze. I did not know that. But, and then so in the 1980s, a little over 30% of adults in the U.S., these are all U.S. statistics, they were not engaging in any type of leisure time physical activity. The average amount of fruits and vegetable servings that adults were consuming were a little over 3 servings per day. Our smoking rate was over 33%. Whew, that's very, very different today, and very luckily different today. And the obesity rate was 15%. Jump up to the 90s, the average income has increased to $28,970. The Toyota Corolla was the best-selling car in the world in 1997. And in the 90s, we were getting about a little over 28% of the adult population was still not engaging in leisure time physical activity. So a little bit of improvement, but just a couple of percentage points change. Our fruit and vegetable consumption was going up a little bit, a little over 3.5, 3.66 servings per day. Our smoking rate was going down, over 25.5% smoking rate, down from the previous decade. But our obesity rate was going up to over 23%. As we jump into the 2000s, the change of the century, our average income was $40,343. And Amazon was the largest online retailer, and if you think we didn't even have like Google until 1998, and how fast the internet world has changed our personal and business lives, that just was an interesting little factoid of the new millennium. And 25 to about a quarter% of the adult population in the U.S. is still not engaging in physical leisure physical activity. Our fruit and vegetable consumption has gone down a little bit. Our smoking rate continues to go down to 23.3, but our obesity rate continues to increase. So your state's data probably looks similar to this data on a national level. We definitely have successes to celebrate. Here in Michigan, we have a smoke-free law that went into effect May of 2012, or excuse me, May of 2010. And even though the smoking rates have decreased, our obesity rates are increasing. And we have quite a bit more work to do before states see 100% compliance with the national recommendations in each of these categories. And these categories are important because a third of all of our U.S. deaths are attributable to these modifiable health-damaging behaviors, which are tobacco use and lack of physical activity and poor eating habits. And our employee lifestyle choices count for a vast majority of the health care claims. About 87% of the health care claims, according to an Indiana University Purdue study. So the workplace is a natural environment to cultivate a healthy lifestyle, and that is why we were here, and that's why we continue to share, because 45% of our time is spent in a workplace. About 80% of U.S. Adults have some type of linkage to a worksite, whether you're an employee or you're a spouse or a partner of an employee or a child. We are linked to workplaces in some way, shape, or form for the most part. So these lifestyle choices we are seeing in our employee populations, the overweight, cholesterol, blood pressure, cardiovascular disease, smoking, diabetes. These types of behaviors get us to where these chronic conditions are prevalent within our employee population. Now, some of these are preventable, but a lot of them are at least manageable. So here at the Michigan Department of Community Health, we're seeing that those lifestyle choices that employees had in the 80s, 90s, and 2000s have resulted in some of our big public health issues today, and especially in the cardiovascular health, nutrition, and physical activity section where I'm seated. Our focus is maintaining heart health and achieving a heart-healthy and stroke-free Michigan. So those behaviors, that nutrition, that physical activity, that smoking, very interwoven into the things that we do in the programming that we implement. So as we go through the rest of the presentation, those will be the major behaviors that we focus on with Worksites. And even though, you know, as we saw a couple slides back, our health has changed, our behaviors have changed. That's also true with the type of programming that we've had to offer on our state level health department. That we have had to change with the times, just like our health behaviors and our health conditions have changed with the times. So again, as I go through, I will highlight some lessons learned, some of the sustainable pieces that we've been able to carry forward to future programs, and so hopefully that you'll be able to take some of these lessons and possibly complement something that you're already doing. So I love this picture because this is a flashback to the 1980s. And I want to disclose that I am not in this picture, but I did, in fact, work at McDonald's as one of my very first jobs. And if I had to choose one of the two young women in the picture that I looked most like at that time, I would probably say the one on the left. My hair is dark and it's a little bit shorter. However, for those of you that were alive and into hair in the 80s, I would probably rather have had hair like the woman on the right, although my hair never looked like that. So she doesn't look very happy, but McDonald's was a good experience for me. In fact, an employer hired me in a future or a subsequent job because I had worked at McDonald's. So he knew that we had to work hard and stay busy, and so that's what he liked about hiring people from McDonald's. But when we go back to the 1980s, President Reagan led our country then. As far as fitness fads, we had Jane Fonda and her workout tapes, leg warmers, and headbands and probably wristbands as appropriate athletic equipment when you went to attend an aerobics class, which was followed by low-impact step classes. Some of the great smoking legislation that came out of the 1980s, that in 1988 Congress passed legislation banning smoking on U.S. domestic flights of less than 2 hours, which then they were able to build on, and then the law was made permanent and extended to flights of less than 6 hours. So that was some of the successful smoking legislation going on in the 80s. And I thought this was very interesting. Mr. Potato Head stopped smoking, and in 1986, The Surgeon General then, Surgeon General Coop, asked Hasbro, the maker of Mr. Potato Head, to stop including a pipe in Mr. Potato Head's package, and then he became, Mr. Potato Head, became the official spokesbud for the American Lung Society and the Great American Smokeout. So things that were happening related to health in the 1980s. So that brings us to the 1980s and where we were as far as worksite health promotion programming. And in Michigan in the 1980s, we started with the Worksite and Community Health Promotion Program. And this was to provide mini grants to community organizations and then also worksites to do screening and classes and follow-up with employees. So throughout the decade, 11 years that the Worksite and Community Health Promotion Program was available, there were 12,000 mini grants given and satisfaction rate of 97%, saying that they would participate again, were happy with the services, and I'll talk a little bit more about that. We had vendors statewide, and I'll talk a little bit more about the vendors, but those were people within within Michigan that were trained by the Michigan Department of Community Health to implement the type of programs that were offered through this grant project. And so some of the services that were offered were either screenings or classes. The screenings were the health risk appraisal, cardiovascular disease screening, and did some fitness screening and evaluation. Some of the classes were tobacco cessation, cardiovascular disease risk education, physical activity education, weight management classes. And then, as I was talking about the vendors would be trained through the Michigan Department of Community Health, so there was consistent messaging by all the vendors going out into these either work sites or communities and offering the programs in a similar way, similar fashion, similar messages, so that there was some type of standard and some type of control that was what was being offered into these work sites. So some of the results that we showed were a high satisfaction rate that the program met the work site expectation, and that was 98%. And 96% of the work sites that participated said that the program, the Worksite and Community Health Promotion Program, was a motivating factor or an incentive for them to offer worksite wellness services at their work site. 64% of those that were found at risk had spoken to their physician at a time at a follow-up call. So once the risk was identified, the employee was counseled, and then follow-up was done to see if they had followed through with what they should have done and contact their primary care physician. So 64% were found to do that. In keeping with our decades theme, the Worksite and Community Health Promotion Program continued through the 1980s. So it started in the late 80s and continued straight through to the 90s. And that was a time when the first President Bush was president the first few years of the 90s, and then President Clinton was elected and finished them out. Some of the fitness fads that we saw in the 90s were we took our exercise and kept it in-house with us and bought treadmills and stationary bikes and a surplus of as seen on TV type equipment, physical activity equipment, which I have been a sucker to buy a couple times. The Bowflex, the Suzanne Summers, Thigh Master, all of those things that you may have seen commercials for in the 1990s. Our smoking cessation success in the 1990s, Vermont is the first state in 1993 to ban indoor smoking, though at that time bars were exempt. So we're starting to see some of those state legislations passed to ban smoking in public places. So things are starting to improve in the smoking arena, and just some interesting factoids on what was going on in the fitness fad in the 90s. So some of the lessons learned through the Worksite and Community Health Promotion Program, they were able to access some hard-to-reach populations. At the worksites, 44% of the participants were men, so that's sometimes a hard population to reach in a community screening, might not be your normal audience. Also, African Americans were a population that was hard to reach, but able to reach more within a worksite setting. And 9% of those hard to reach populations were rescreened because they were able to, when they were shown to have a risk factor, they were able to get 9% of those back in and get rescreened. So not 100%, but certainly one more way to reach those hard-to-reach populations that might not go for community screenings, might not be going in for their preventive screenings with their physician, might not have a physician, but able to reach them through this project. One of the other lessons learned, it might be an unintended consequence, kind of like how I am now part of a wellness program here at work, is the increased morale. And we did hear this quite a number of other times throughout the subsequent decades and different programs that, you know, we're offering these programs, or these employers are offering these programs, and they're hoping to improve health. But the the wanting to cut costs, but employees get to know coworkers in a different light, and that increases team building. That it might have decreased absenteeism, but another benefit was the supportive environment that offering worksite wellness activities fostered. So increased morale was one of the successes and things that we heard testimony from the employers that was maybe not necessarily a health outcome, but something that certainly employers recognize. And then I already talked about the consistency among wellness consultants, having that avenue by which consultants could be trained before they were out in the work site, helping them implement projects, helping them to keep up to date on the national recommendations and have some consistency in how the programs were being implemented. One of the components sustained, and I will talk a little bit more about this in a minute, is the vendor directory. And the vendor directory has the wellness consultants in it, and it shows what types of programs they're able to offer based on the type of training that they've had and based on their area of focus. Another one of the components sustained is the Michigan Department of Community Health continues to be a recognized resource for employers to go to. So this was one of the what I want to say, as we built the program for those 11 years or over a decade, employers became familiar with the state health department, knew that there was a place to go for resources. So it established a relationship and an awareness within the employer community. And then some of the screening forms and techniques that we used in the Worksite and Community Health Promotion Program are still with us today. We have a community screening form that we offer to organizations that identify some of those heart risk factor or heart disease risk factor things in an employee's life or a person's life. So that form is still with us. And we also have a blood pressure CD training program for people within Michigan to demonstrate the appropriate ways to take a blood pressure, and that is something that kind of sustained from the Worksite Community Health Promotion Program. But we still do have a listing of our worksite vendors in Michigan. This was last updated in 2007, but it does go through, and List 2 was doing what still almost a decade after the program ended. And just as a great resource for people to refer to if they're looking for somebody to do something within their community, they could look into the vendor directory and find somebody that might be able to offer a service that the employer is looking for. And also that we've used it to either invite these vendors to participate in groups or provide feedback for some of the programs, or to try to implement some of the programs in Worksites via some of our pilot projects. So we do continue to refer to this list of Worksite vendors that participated in the project, and they have a wealth of information and a wealth of experience that we can certainly benefit from in Michigan. Okay, so keeping with the decades theme, this actually is a picture of me, and I want to call this, I call this my Ergo Christie picture, because I look at it and I'm thinking, what the heck am I doing with my neck craned like that? And you can tell this is in the 1990s because you can see that huge, gigantic, clunky typewriter in the background. And I was happy to see that I at least had a computer on my desk, but we were still using typewriters and computers. But this is the worksite that Teresa was talking about when she introduced me, that I became introduced to Worksite Wellness. And it was at this worksite that I had a teammate that came up with our name, LBLTRNU. And when he came in with that name, I'm thinking, what the heck is this? If you say it really fast, it's I'll be healthier than you. So I thought that was pretty clever. And so I can't take any credit for that. That was my teammates doing. But as we leave the 90s and jump up into the 2000s, the turn of the century, we probably are all either we were participating, we were employed, or old enough to remember that the Y2K thing was just a great big concern, and businesses were very concerned that everything was going to shut down at the turn of the century. And I know that in my own household we had a little bit of store of supplies, and just a really big things happening at the turn of the century. Our second President Bush took office during that time, and as far as fitness fads were going on as the turn of the century in the 2000s, we're going back into participating in group activities. So high-intensity classes like Taekwondo and spinning, and then some of the lower impact classes such as yoga and Pilates and Tai Chi. And so we're looking for those things that keep our bodies physically fit, but also reduce stress and kind of calm our minds. So a little bit different than those ab machines and other crazy things that might have been shown on TV. However, if those work for you, I'm really glad, but those types of things never worked for me. Some of our smoking successes, that Ireland went with a complete smoking ban on March 29th of 2004, after St. Patrick's Day, of course. But that isn't necessarily in the U.S., but the U.S. was seeing more and more states becoming smoke-free, and I think I mentioned that our Michigan Worksites went smoke-free last year, so we have a lot of great examples and great lessons we can learn from our smoking friends or our smoking cessation friends that they've been able to pass successful legislation. So kudos to them. So with the new millennium, it came some new programming for the Department of Community Health. The Worksite and Community Health Promotion Program went away. We were now focusing going away from more of those one-time classes, individual screening type of programs, and into looking into more of a environmental. What is your worksite doing to support healthy behaviors? What kind of policies do you have in place? And people that have presented on the state of wellness in the past year have talked about this also. And but I just wanted to give you a frame of reference. In the early 2000s, that's where we were changing, and we started that off by doing a pilot project called the Heart of Kalamazoo. And in that, we tried to incorporate all those essential pieces. You have a worksite wellness team, you do an assessment, you do an employee interest survey, you do policy and environmental changes, and in this pilot project, we looked at organizational strategies, we looked at the healthy eating environment, the physical activity, tobacco use, stress reduction, and preventive care. And like I said, this was a change from the one-time screening-only type programs that were going on prior to the 2000s. So as we worked with a small group of employers in Kalamazoo in Michigan, and that's a little bit south of Lansing, and Lansing's about in the middle of the mitten of Michigan. And in fact, there were 9 employers affecting about 500 employees. And the average participation at each of those employers was about 80%. So that's pretty darn high. That's a really good participation rate. And about 12 changes were made per worksite. Now, this was part of the program that you would do the assessment, do your planning, implement the changes. And but to do about 12 per worksite was fantastic. So under the organizational strategies, at the pre-test, they had about an average of 2 strategies per worksite, and at post, at the end of the project, they had increased it to 8. Under healthy eating, the improvement was modest, but there was about a 20% gain from pre to post project. The physical activity, again, there was a small improvement seen, but the worksites averaged about 2 changes per worksite. And tobacco use was very, very small change. Either there wasn't a change at all, or there was maybe 1 change. And some of the things that we saw employers do for tobacco use was offering quit kits to those who wanted to help, wanted some help to stop smoking. Several of them offered financial incentives for to employees to quit smoking. And as far as preventive care changes, that was another really big change area that worksites went from an average of 4 types of policies or procedures or environments to 8. So quite a big increase in the preventive care section of the policy and environmental change. And what we learned is the techniques to increase participation, that worksites needed multiple ways and multiple avenues for communication for getting employees involved. And one work site suggested putting people on the wellness committee as a way to get them to be more buy-in and participate in the wellness activities. But the emails and the frequent communications on maybe how things are going, frequent newsletters, bringing it up on staff meetings and some of the posters that they are posting it within their work site. To sustain momentum and motivation, some of the work sites that participated in this program already had something going, but many did not. So they, as a group of 9 employers in the Kalamazoo area, decided that they would continue to regularly communicate with one another to be a support system, to share ideas and use the community resources within their area to promote employee wellness. And then assign activities to lessen the workload. This was something else that they told us about, that you know, you might have to, one person might have to devote 20 to 40 hours per month to wellness, but if you divide up the activities, then the workload is lessened for everybody. So the components sustained from this program, this was a model for our policy and environmental assessment, which I'll talk about in just a few minutes, and also some of the sustained pieces were success stories that came out of from the work sites that participated in the program. And this one really stuck with me because they made some healthier choices in their vending machines available to their employees. And these ladies worked at a residential home where people with disabilities lived. And not only did the employees like the healthier choices in the vending machine, but the residents found out about it, and the ladies described things were just flying out of the vending machine. All the milk was gone, and all this, you know, all the healthy things were gone. So again, unintended consequences that they had put in those healthier items within their vending machine, not only benefiting the employees, but also benefiting the residents. Teresa, as she was introducing me, talked a little bit about the Legislative Health Challenge. And in 2003, we had a new governor. Jennifer Granholm became our governor, and she was really tuned into health, and that was evidenced by a Mackinac Bridge run that she helped to get up and running, and people would go into a lottery and be able to run across the bridge with her on Labor Day. And I saw her a couple times on her bike riding down to work from her home. So she was really, really engaged in and keep leading a healthy lifestyle. And another evidence of this is that she appointed our Surgeon General, Dr. Kimberly Dawn Wisdom. And Dr. Wisdom was charged with trying to create a healthier Michigan by promoting those healthy lifestyles of getting enough activity and eating healthy and not smoking. And so in response to the new Surgeon General, the new governor, and things to kick off as far as healthy lifestyles, we had a legislative health challenge for the legislative, judicial, and executive branches. And just by the nature of that, that employee population, it was extremely competitive. It was a walking challenge. They had pedometers, which were provided to them. It was 16 weeks long, which was kicked off in December, so not the nice part of the year. But 100% of the respondents reported that their activity level had increased because of the challenge. Excuse me. And 65% of the respondents reported more than 20 minutes of vigorous physical activity on the previous day, previous to them answering the survey. And 2/3 of the respondents indicated that they increased their physical activity level, and now that kind of doesn't totally jive with the 100%, but Maybe that was it from the previous day. So excuse me for that. About 25% of the respondents said that it helped them to manage their stress. About 25%, 24% said it helped them lose weight during the challenge. And 98% of the respondents indicated that they would likely participate in similar activities, and 96% said they would recommend this activity to other people. So the lessons learned in the Legislative Health Challenge was we needed to be mindful that technology presents challenges, that it was a web-based challenge, and sometimes the websites were not working correctly. And also the pedometers sometimes were not working correctly. So things like that present challenges. Being clear on our communication and how to log steps, troubleshoot pedometer problems, where to go for directions, are some of two of the lessons that we learned in the challenge. And weather affected participation. Those said, I didn't get very many steps this week because of the weather, or I didn't participate because of the weather, that maybe kicking it off in a sunnier part of the year might have seen more participation. And then some of the components sustained were the online tracking tools. We continue to hear that competition and team aspects are wanted in a worksite wellness program, so we use some of that, those lessons learned in our competitions, and the frequent feedback. So we did hear about that, the frequent communication needed to keep people online, or in line and on focus. And this is what the challenge looked like. It's no longer up, but this was also a basis for other tools that we have online for worksites. And I've provided the link for you, or the address for you, which will be available after the presentation. The newly appointed Surgeon General was charged with creating a social marketing campaign, came up with Michigan Steps Up, to move more, eat better, don't smoke, using a web-based way to get out the message, also some media messages, PSAs, but worked with partners and work sites in schools and communities and healthcare and faith-based organizations to help develop what those different venues wanted to provide to other people within those venues. So we had a group of worksite professionals that came together and talked about what worksites in Michigan need to achieve this move more, eat better, don't smoke goal. So in June of 2004, about 200 stakeholders came together and started to help us develop the Michigan Steps Up Healthy Lifestyles campaign and what it is that we wanted to offer during that. What we learned as far as businesses being aware of employer issues, especially working with unions and different messages for different types of businesses, small, medium, and large. Maybe you have a mainly manufacturing versus an information type business versus a public service business. So tailoring the messages to speak directly to the employees that you're trying to reach. Businesses also talked about the competition and needing to tell their story and share their story among their peers, and businesses are highly competitive in many instances, and any kudos that they can get really are helpful and kind of promote goodwill among their communities. And oftentimes we were asked, what are the state employees doing for wellness? And so practicing what we preach was an important component of this, and what are we doing, and why aren't we doing this, and how can we be better role models and do what we're asking the businesses in Michigan to do. So some of the components sustained that I'll go over are the Worksite Wellness Chronicles, the Health Risk Appraisal, and our network of businesses. The network of businesses speaks to the over 50 partner businesses that came together to help us design some of these components for the Michigan Steps Up program. And we continue to go to them as a resource and as a information on what the businesses need out in Michigan. So this is the Michigan Steps Up website right now, and on the left-hand side, if you go to this website under businesses, you will see many of the resources that our business partners asked us to provide. So I have provided the website there, and again, it's under the businesses. And there are some updates that need to be made, but there's still some really good information there, and we continue to refer businesses there to have a starting point. Another component that was sustained is the Worksite Wellness Chronicles. And I want to give recognition to North Carolina for this idea. They had something similar, but Worksite Wellness Chronicles were a way that we could highlight businesses. We gave a quick overview of what they were doing, one of the benefits that they were deriving from that activity, excuse me, and some of the lessons learned. And then it also, at the bottom, it talked about what risk factors it addressed, how much it cost to implement it, how many people were reached. So really gave a nice summary of the worksite wellness activities that were going on in that business. And we have probably close to over 20 of these on our website that you could go to see. And then our other activity or other resource that was sustained was our health risk appraisal. And I want to give credit to the University of Michigan's Health Management Research Center, who helped us provide our HRA online. And Michigan businesses are able to contact our office to get a group code, and based on that group code, if their employees use that when filling out their HRA, they can get an aggregate report. Now, there are a lot of people on this call that aren't in Michigan. If you have employees in Michigan, you could use the HRA and get a group code. However, employers outside of Michigan aren't able to use this because it's kind of a Michigan tool. But this is also available on the Michigan Steps Up website, and the aggregate report would be for businesses that had over 50 employees complete the HRA. And this brings us up to our assessment tool, kind of building on the Heart of Kalamazoo project, kind of building on what we heard from our business partners through the Michigan Steps Up project. And this is a policy and environmental assessment that assesses worksite health promotion, tobacco, physical activity, and nutrition. And this is based on a lot of different feedback from not only those participants, but also from other states. We had California, Georgia, Missouri, New York, all had resources that we reviewed and helped to build this online assessment. So the Worksite Wellness team goes through and answers questions related to these 4 areas, and then they put down next steps, what they're going to do, what they see as what is going well, what they have opportunities to change. So it kind of is a assessment and planning tool. It also provides the worksites with a scorecard in each of those areas, how they're doing related to businesses of their same size and also within their same type of industry. And also the online assessment has conditional questions, so if your worksite doesn't have a cafeteria, you won't have to scroll through and try to find the next question that applies to you. It kind of just bumps you right up to the next one that applies to you. Lessons learned, the assessment tool has a limited focus. We realize that there are many other things that constitute wellness, stress, and some environmental air quality type things, and safety. So we don't have all of that in here, but it's a great starting point for our business. Keeping it current, it is online, has a lot of online links, so keeping those up and running are always a challenge, as I'm sure that those of you that have online tools have found. And then giving follow-up to encourage and monitor change is something that we need to build on. Like we heard in the previous projects, having that regular communication and having that motivation to do those changes are needed to help to move people forward. So right now, sustainability, it's up there indefinitely. It's been available since 2006. We've frequently updated, and we do have a way to give standardized feedback back through that scorecard to employers for them to use when they're designing their programs. So this is just a quick overview. People that are outside of Michigan can use this tool. We just ask that you put in your actual address. You can pick, it's going to ask you for a county. You can pick whatever county you want to be in, but if you could please use your actual address, and that helps us filter out the people that might not be in Michigan. But it's a great resource. It's available. We've had a lot of interest from other states and even other countries in asking us a little bit more about it. So one of the things that we can provide Michigan Worksites. And the National Governors Association Healthier Worksites project used the online assessment tool, the HRA and employee interest survey to help small employers develop action plans. And we also used those Worksite Wellness Chronicles to highlight each of the changes that those worksites made. And the overall results from this project was the participation rate was over 50% per worksite. About 82% of the worksites that participated devoted at least 1 hour of a week to wellness. And they all those that participated plan to continue with worksite wellness programs. And what I wanted to talk about, because we're coming down to just a few more minutes, but I wanted to talk about the resource guide that that's based on Wisconsin's resource guide, and that is one of the components that was sustained for the Healthier Worksites project. So the participants gave us some feedback, and we used that to Michiganize the Wisconsin resource guide. But this is just some participants in that National Governors Association Worksite project. And I'm most like the guy in the back. I'm very unhappy to use the stairs, although I know that I should. So they looked like they were having a good time, and something that everybody that has stairs could use to increase their physical activity. And here's where you can find the Michigan's Healthy Workplaces Resource Guide. And building on that partnership, we had a Michigan Cardiovascular Business Alliance. Their messages to us to not reinvent the wheel, have that marketing plan to reach out to businesses, but have messages that are meaningful to businesses, and recognize healthy businesses, whether it be in a Worksite Wellness Chronicle or to develop some type of formal recognition saying that this is a worksite that has done things within their employee population to promote health. And one of the last things that we've done is we've developed a 8-week worksite wellness program that employers can take to educate their employees on heart disease and stroke. And it's a ready-made, go-to-it, gives you all the instructions, has a survey, planning pointers for sessions, tips for increasing participation, has the handouts and step-by-step instructions. So our pilot project showed that there was statistical significance in knowledge increased for heart disease knowledge, stroke, cardiac arrest, aspirin, sodium, and diet. So as I'm wrapping up, we have done a lot over the past 3 decades, and this is kind of a strategic planning process where we look at our strengths, weaknesses, opportunities, and threats. And that actually is a picture of me, and we were doing strategic planning there. And then what we should do as we move forward. But as you know, sometimes it's easier putting it on paper than it is implementing it actually in a work site. So this is my unintended consequence. We moved into a building in about 5 years ago and needed a way to bring employees together. And so we were starting to develop some kind of social programs, and it kind of evolved into a worksite wellness program. And we have just really had a great amount of participation. It depends on what type of activity it is, but we have created a culture of wellness when we started off on just trying to bring people together. So we do have a volunteer committee. Things are we have to pay as we play, or they're donated, but we have surveyed employees and offered them things that we know that they need. We've had management support to make it a priority, and we have also done things to standardize processes, whether it be a request for an activity or to our surveying employees. Our components, we've sustained our fruit basket, our walking club, our brown bags, things that we have started off and have continued to be able to offer within our building. So some of the obstacles that we have overcome are we've modified times to accommodate employees' busy schedules and modified lunch times. So we offer our programs in half-hour increments. We offer simple creative programs such as our Watch Your Weight at Work versus the Weight Watchers at Work that we weren't able to get in. We have a staff person that just kind of brings together as a support group some people that want to watch their weight and having wellness as an agenda item. I am going to stop now and see if there are any questions as we are about out of time.
Thank you, Christy. That was great. I love the way your approach of going through the years and kind of put it in perspective of what was going on in the country and then how that relates to worksite wellness. So I really enjoyed that. Thank you for that. One question, and I know we've got like 1 minute, but I noticed that it seems like the worksite wellness efforts may have started earlier in Michigan than I know in Kentucky or some other states in the 80s. And so I just wondered what you thought that was attributed to.
We had some legislation that was implemented in the late 80s, and as a result of that came that Worksite and Community Health Promotion Program. So that was as a result of some legislation that was passed for the community health.
I think it shows the strength in those policies. And for time's sake, since we're out of time now, we thank you, Christy. And just a couple of quick announcements. One is that we had a challenge back in June. It was the webinar that Jason Lane from CDC did for us, and there was a challenge for the state that could have the most participants in that webinar. And so we have a tie. We wanted to announce that today. So we'll have to look back to our rules, Kelly, and see what we're going to do on a tie. But that's Maryland, Washington State, and California had the most participants in the webinar in June. And also, just as we wrap up, we do have webinars coming up for the rest of the year, October, November, and December. October, I think is going to be, I don't have the date yet, but that's going to be a focus on the changes to the toolkits that the states have produced. And then in November will be a strategy again. In December, we have a CDC person, Pam Allwise, who works with the Diabetes at Work program. Kelly?
Yes, so everybody, thanks for coming today, and we'll see you next time. So,
Thank you.
all right, bye-bye.